How do you know if you're receiving quality care at your doctor's office? There are multiple factors that you can observe and assess while you're there to determine, is the care you're receiving quality or is it just a mill? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Now, there's a difference between spending time with a patient in a way that is efficient or inefficient. So just because you have a short visit with a doctor doesn't mean that that office is a mill if they're being efficient with the short amount of time that they have with you. The problem, though, is in conventional medicine in the United States, the average office visit is 8 to 12 minutes, and the average time a patient has to speak before the doctor interrupts and begins speaking is 30 seconds. The average patient in the United States has a chronic disease, at least one, but many times has multiple. So to serve that patient properly and to provide quality care for that patient oftentimes requires listening for more than 30 seconds and an office visit longer than 8 to 12 minutes. So if you're a patient who's been in this care model and felt like you were run through a mill or felt like you weren't listened to, then I sympathize with you because it's happening almost all the time, almost every day. So let's look at three major factors that are important for providing quality care. The first one is the time spent listening to the patient. So up on top here, we can go time / listening. Like I said, you can be efficient with time, but often with patients who have one or more chronic illnesses, it's going to take some time to listen to the patient, get a thorough history, ask detailed questions to piece things together and get an idea as a clinician of what the differential is that I want to assess. And so the second piece is what's called the differential diagnosis. And so as you as a patient are speaking to the doctor in their mind should be creating a differential, or basically that's a fancy term for a list of things that they think could be at play in your case and that need to be ruled in or ruled out via examination and or laboratory testing. If you walk into an office and say, I'm suffering from fatigue, constipation, and brain fog, and they say, okay, here, take this pill, they didn't really listen to you other than getting that list of symptoms from you, and they didn't create a differential. They basically heard the list of symptoms and gave you the pill that they think best fit that. The problem is fatigue and constipation and brain fog are all non-specific symptoms. So they don't tell you one system that's going wrong that should allow you to reflexively give a pill. Those three symptoms require a differential and further work to figure out, are they due to neurodegeneration? Are they due to gut infection? Are they due to autoimmunity, et cetera, et cetera? So there shouldn't be a reflex pill given 30 seconds after you say what you have. So we want to invest time listening so that we can create a differential that can then be ruled in or ruled out via exam and testing. So in that same person, if they're complaining of fatigue, constipation, and brain fog, I'm creating a differential in my mind and asking further questions to zero in that differential. And let's just say I created one of it's neurodegeneration, or it's a nutrient deficiency, or it's autoimmunity. Okay, well, how do I know which is which? Should I give 3 pills that would cover each of those things? Well, no, because there's no pill for neurodegeneration. So that wouldn't work from the start. But no, we want to be efficient and specific to the person and figure out what the actual cause is. That's where exam and testing comes in. So you do your exam, you do your testing, it all comes back, and the results from those things say, well, it's not neurodegeneration, and it's not a nutrient deficiency, so it is autoimmunity in this person based on the exam findings and the test results that show antibodies against a certain tissue, et cetera, et cetera. So that is how it should work, and that's how that person receives quality care and specific care to them, and actually gets answers and clinical results that result in a life at optimal. That kind of care is called functional medicine, and that's what I do every day at Functional Medicine Charlotte. So if you're looking for healthcare that's based on listening and learning your case, and based on a doctor using their brain to create a differential so that they can then zero in on you and look under your hood to prove, hey, this is what's real and this is what's not real, so we don't have to worry about it. This is the thing that we're going to take clinical action against, and then we can go back in the future and retest and objectively say, hey, we are achieving the results we set out to achieve, and they match your subjective reports of your quality of life improving, and you are reaching that life at optimal.